Good afternoon and welcome to the Dental Community Resource. For those of you returning to Tuesdays at 2, this is our 8th webinar focusing on information as it becomes available regarding dental emergency and urgent care in the province of Ontario while we're under a state of emergency. I'd like to recognize our faculty who continue to support us and work tirelessly from one week to the next in providing us with information that we can bring forth to you on our Tuesdays at 2 webinars. For those of you who are new to us, a warm welcome. We've been engaged in this process for the last 8 weeks, trying to make sense of emerging information in the context of how it relates to urgent and emergency care. I'd also like to thank members of our team, our staff, who also have tremendous support to us as we try to synthesize the information in a usable manner for you, our community. Yesterday afternoon, we received an update from the Royal College of Dental Surgeons of Ontario, a message from our president reminding us that we are currently still in a state of emergency, which has now been extended till June the 2nd, originally was May 19th, and that as far as the Royal College is concerned, any changes to the guidelines, which currently only relate to urgency and emergency care, will not take place before the state of emergency is lifted. We've spent the past couple of weeks unpacking and focusing specifically on the document received on April 24th, which focused on guidelines, new guidelines, in particular as they related to urgent dental care in the province of Ontario while we're under a state of emergency. This week we decided to take a different approach and reach out to get a sense, to give you a sense of what it's been like for other colleagues around the world who've actually already gone back to routine care or still managing urgent care in different parts of the world. Steve?
John, if I can, good afternoon, everybody. We were talking amongst ourselves about this week in particular, as we're waiting for our guidelines. We're sitting, some of us impatiently, some of us patiently, waiting for the news to come from the college and from the ministry on when we can return. And I think we all agree that it's inevitable and it's just a matter of time that we'll be going back. And we started to wonder, what's that going to be like? What's that going to be like for ourselves and for our staff? And we were trying to, we're all sitting here trying to prognosticate, trying to guess what that would be like. And we thought maybe we should go and ask people who've recently gone back to work. So I think this is an interesting collage of 3 of our colleagues that we've known that have recently gone back to work in 3 different areas of the world. And I think you'll find it interesting to hear the differences, but more importantly, the similarities. And I think we can really turn inward and realize that's probably what's in store for us, something that we're going to see in these next few minutes.
Yeah, and if I may add, after weeks and weeks of uncertainty and negative press and just feeling down about how things are in state of affairs, we want you to sort of keep in mind with these 3 wonderful colleagues of ours, wet finger dentists, that just remember the take-home message is sort of there's light at the end of the tunnel here. These are people who have been in the thick of things, different parts of the world. And so keep that in mind when you start thinking about yourselves and your practice and your staff and your patients.
So here's to thinking about returning to work. Here are some of the interviews with our colleagues. A warm welcome to Dr. Lorenza Massarelli, who joins us from Montepulciano in beautiful Tuscany. Welcome, Lorenza.
So I heard you're back to work, my dear. Congratulations.
Yeah, thank you. It's hard. It's hard.
Yeah, tell us about it. That's why we're calling. Tell us about it.
Yeah, I just figured. But yes, we started Monday 4th without any guideline, any official guidelines. So everyone started as, with common sense and what were the previous guidelines for the emergencies. However, today we have an embellished guidelines, about 100 pages official guidelines that no one has already read because it's too much stuff and the things are always the same.
Can you read 100 pages to us in Italian, please?
If you want, I can. Much better than my English, so with pleasure. Okay, the first thing is that it's really, really difficult because at the end of the day, you are really tired, really, because the main thing is to not touch anything. To wear all the masks, all the overall. You have to keep attention, to keep your mind focused on everything that you touch, you know. Then he has to perform the usual 2 rinses, one with hypochlorite, 1%, and the second with chlorhexidine, 2 rinses. Mandatory, the rubber dam, but for me it's not changes because I've already used any time that I needed. We organized ourselves trying to use 2 surgeries, 2 rooms for each doctor. So when one is empty, the assistant had enough time to clean and ventilate it. In this period, you have to be really careful because it's plenty of jackals that want to sell you every, you know, vain thing that you really don't need. So you have to think about what you will use after this tragic period and if this item is really necessary or not. To try to avoid some con, you know. Of course, the hygiene is still manual, and the aerosol is a problem whenever is possible. Rubber dam. We have 2 masks. One FFP2, which has a power of filtration on 95%, and over and the normal surgical mask, and over, you know, some special glasses and a visor. We are like astronauts. I have a seasonal allergy, so I can't breathe. I struggle to breathe all the time. So I'm not lying to you, Stephen and Manor or John. I think that every day we improve a little bit. So it's difficult to work in this way, but we can adapt.
Is it getting slowly easier than you mean?
Yeah, slowly
and psychologically.
easier because you adapt, you know.
Yeah.
Every movement become slowly an automatism. You know, two spaces of passion. The one who doesn't feel any fear, which for me is crazy, you know, the one that they still doesn't believe that there is the virus, and they are so brave, they don't fear anything. I hate them. And the one that feel instead, how can I explain? I don't think is safe is a strong word, but at least that the dentist is doing, you know, the right thing with all the disposable things and the protection as possible. They see us that we struggle to keep everything, you know, clean and sanitized and everything.
But the patients are coming back. They want to come back.
Yeah. They want to come back. I think that the large part appreciate our efforts. They are scared. They were scared.
They appreciate everything you're doing. It sounds like you're being really careful, which is beautiful to see. But is that more comforting for them? Is that making their life easier?
Yeah, slowly, day by day. The key is to feel them safe, to make them feel that we care of them, you know. First thing. So if you show them that you are afraid too, but you fight again with them, they give you their faith, you know. And day by day is getting better, but I cannot lie, it's tough. And so we work with this air conditioning so low that when you undress yourself, it's freezing, really. You know, I'm a positive person, so I think that we can adapt. We really can adapt. It's the first week, so obviously the first day we were all scared. We were scared. So the second, less scared. At the end of the day, we had a, you know, we opened a champagne, not a champagne, but we had a little cheers because we made it. We made it. So I think that after a while, maybe with some training, with the repetition of all the gestures, because it's still our work. We are, you know, trained to work against bacteria or virus like no HCV or something else. So we hope that the virus will attenuate during the summer. We are hoping that a new treatment we will arrive in the horizon, you know, against the COVID. But if we have to keep working in this way, there is a margin, no, to improve our skills in this astronaut attire. Yeah, we can do. I'm here, you know. You see, look at me. I'm still alive, so we can do it. I can do it. It's tough. It's really tough. You sweat a lot. You are the first, second, third day. You're worn out. Totally, you're worn out because you keep focused and you have anxious. You know, you are anxious about doing all the proper thing and movement. But at the end of the week, you can see a little light at the end of the tunnel.
No, that's great.
Yeah.
That's great. Good for you. Good for you.
Thank you.
We're happy to hear it because you're a little bit ahead of where we are in our part of the world.
Yeah, just a
but
little
we also
bit,
have to deal with the N95 and everything. The bad thing for us is our weather is not as beautiful as yours. So
it's true.
So we're still jealous. But good for you for what you're doing.
How can I say? We are lucky. At least we have the sun.
So Lorenza, on behalf of Steve Minor and our Dental Community Resource, a big thank you. Grazie mille for taking the time with us, for your sense of optimism. It's a wonderful message that we'd like to share with our community. Okay. Un abbraccio e a presto.
Ciao, ciao.
Thank you, Lorenza.
Ciao, un abbraccio a tutti.
Thank you.
Un bacio.
Bye.
Ciao.
Bye, Lorenza.
Ciao, ciao.
Okay, well, good afternoon and a warm welcome. We're here today to have a conversation, a chat with a dear old friend, Dr. Ansgar Cheng, who joins us from Singapore. Hello, Ansgar.
Hi, John. Hi, guys. How are you doing over the other side of the world?
We're hanging in, right, like the rest of the world. Thank you so much for making yourself available today. Ansgar, if you could just share with our group, please, a little bit about the nature of your practice, where you're located, and a short summary of the state of affairs in Singapore.
Right. Now, as this is happening, it's 9 o'clock in the morning in Singapore on Saturday. I'm with this place, Specialist Dental Group, which we have started in about 2004, right after SARS. I left Toronto in 2004, a few months after SARS settled. We are a multiple specialist practice. We have about 12 specialists in here. In Singapore, the weather is always hot, hot, hot. We have summertime year-round. So this is the place. Welcome to my place. Singapore, we can summarize into two phases right now. At the very beginning, about Chinese New Year, which is about end of January time, then the news about the virus showing up in China become a more common knowledge. At that point of time, Singapore is still quite, relaxed, I would say, in a way about that. And then after Chinese New Year, then some cases show up in Singapore. Initially, it was very much under well control. And then about a month ago, then suddenly the number of cases skyrocketed by a lot, from a few hundred cases, and suddenly now we have almost 22,000 cases. In general, our patients are okay with it. I don't hear anybody having any comments about the distrust of the safety of coming to see a dentist. This is, I think, the general feeling. But of course, in our office, because we're located in a private hospital, anybody who come into our hospital have to go through what I call immigration, because they have to go through the scanner and they have to check the QR code, because in Singapore, basically almost every place you have a QR code. You use a cell phone, then you check in and check out. So for contact tracing. And even our office, we have our own QR code as well. So people come in, they have to go through the immigration downstairs to check the temperature, they have the travel history, all those things, and QR code, and then come into our office, they also have to do the same thing, and then check out, have to do likewise. And we have the same system. You go to a bakery, you go to a supermarket, so on and so forth.
So if I may ask, how did your staff feel, or how do they feel about, so patients one thing, but your staff, have they been comfortable or nervous about coming in? If some of them felt like, no, I want to stay away from this environment, or was that a non-issue?
In terms of our team, I would say we have a little bit of a problem to control the excitement to come back to work. Honestly, that's the situation. About 2-3 weeks ago, there was actually a day, then we were in the office, that I said, geez, we have all the colleagues here. And honestly, because the patient load go down a little bit, then I said, you know what, we need to have an emergency meeting. I said, you know what, guys, girls, we have to stop coming to work.
I was just going to ask then, for us here, I mean, you had spent some time in Toronto, familiar with the city and practice in this part of the world too. Any words of advice, recommendation for us, as we're still under a state of emergency, still only providing emergency and urgent care? Any thoughts that you can share with us from your own clinical experience?
My personal take in this is like the following. Practicing in Canada, I practice in Hong Kong, and also did a little bit of work in US as well. I would say we're pretty much practicing at the same level, okay, in terms of universal precaution, things like that. I don't see any difference going forward. So I think the standard that will change with time passes. I can see that all 4 of us here of the younger generation group, there's a reason why I raised this, because those who are in the 60s or 70s, they used to practice in a situation there's no gloves, no eye protection, no PPE, okay, and even no sterilization. Back then, you just wipe down your equipment with alcohol, or just sometimes just wipe it down, okay, with water or whatever. And that was not too long ago. There was only a time in the 80s when we were kids, when we were on the verge of going to dental school. And since the late 80s onward, then universal precautions start to exist, and then we start to sterilize everything, autoclave everything, right? So standard will change with time passes. And I believe that through this, there will be some minor tweaks in the PPE and the sterilization protocol. And going forward, I believe that we will up the game a little bit more. We will get out of this because for the history of mankind, you think about it in the last 200, 300, 400 years of time, we always have a little bit of problems here and there. When we're going through it, you feel like crap, but those are actually small bumps. And for the last 200 years or so, we've been going better and better and better. So I think this will be a small bump. I hope it is the case. And we will be better. We, meaning mankind in general, will get on better at this.
Thank you. Thank you, Ansgar, so much. Really appreciate you making the time for us. Really enjoyed hearing your perspective. It's nice to get a global sense of colleagues like yourself on what it's been like to be practicing again under these circumstances. On behalf of Steve and Manor and the rest of our dental community, thank you so much. Continue to be well and stay safe.
Thank you very much.
Thank you very much.
I want to thank my good friend Ken Parrish from the United States, who's going to tell us a little bit about where he practices, the nature of his practice, and what exactly you're able to do down there and what you're not able to do. So Ken, tell us a little bit about you and where you're from and what you're doing presently.
Well, thanks, Steve, and the other guys. I'm a periodontist, but I'm also a PhD in microbiology. So I have a little different perspective on this and spent a lot of time growing highly fastidious bacteria in cultures that could be contaminated by things just floating around in the air. So this is not my first rodeo in managing contamination. I am a referral-based practice. We get patients referred to us for implant surgery, almost exclusively implant surgery, some periodontal surgery. As Steve said, we're in Kentucky, just outside of Louisville, which is the biggest city in Kentucky, and also the site for the most cases in the state of Kentucky, and that's not to be unexpected, simply based on population. Well, they're certainly more anxious. I think the way to manage this, and if I can take a quick step back, when we were looking at returning to work, I saw this as us having three challenges. One, following the dictates of the Board of Dentistry, our governing body in the state. Number two, making sure that I was taking care of the safety of my staff and the comfort, and number three, the safety and comfort of my patients. And so those are the three things that I worried about. Now, I can't control the Board of Dentistry, so I have to just follow their rules so I can control the other two. And the first thing is I would be proactive. I would reach out to patients, whether by phone or by mail, and reassure them that you're still there, that you're still, you have their interests at heart, and you're doing everything that you can do to facilitate their return to your practice to help maintain their oral health. The patients that we've had have invariably been very responsive. We've had only a few patients decline returning, and without exception, those were patients who truly had significant medical issues that probably should not be out anyway, and certainly understandable. We had a few patients who were a bit nervous, and we were prepared for that. Those patients, and obviously no one comes who doesn't want to come. We don't compel anyone to come. But those patients who were a bit nervous, we had made preparations for. We offered them first thing in the morning appointments or earlier appointments when they wouldn't overlap with other patients at all. We made it clear to them that they were going to come in. No other patients were going to be in the area. They were going to be brought back. And we don't have patient overlap anyway. Patients don't walk past each other. There's a 2-meter safe space, if you will. And so they all like that. I think the real key, though, is when you reach out to the patients is you drive this bus. Don't let them ask questions. Right away, you explain to them the protocols that are in place and the rationale for the protocols, and let them understand that you've been very proactive in this, and you've made sure that this is very safe for them, and that you're following the guidelines that you're supposed to be following, whether it's World Health Organization or in our country CDC or the board or the American Dental Association. And patients are very responsive. The most common thing that we hear, as relayed to me by my staff, is it sounds like you have this under control. And so we get that a lot. And so that's what we want to hear. But no, we have had no patients fail to return again, other than except that select group who truly are a medical risk, and who I truly did not want to return for a short time anyway. We're allowed to see patients for all procedures. We had about a 6-week hiatus where we were only allowed to see emergencies, but that has now been lifted. And so we're doing all procedures in my office. The hygiene is actually not started yet because of the aerosol risk in that regard. But every other procedure that we do, we're doing, and we're allowed to do by all the governing agencies in the area. First thing we have to do is realize our staff has been sitting at home for 6 weeks watching television that is telling them that they're going to die from coronavirus if they step outside of their door. And that's all they know. And so they're going to be nervous. I have a fabulous staff. Many of them have been with me for a number of years. They're well trained, they're experienced. But I got to tell you, that first meeting we had, there was some palpable nervousness in the room. And understandably, because they've been inundated with the media about this, the risk of dying. And of course, that's what the media focuses on. So the first thing that I really wanted to do was let them know that I was cognizant of their issues. And so I spent a fair amount of time going through the protocols, getting written protocols for them to follow. They were provided to them ahead of time. They were able to know what the roles were going to be. They knew that I actually cared about their safety and well-being. I made sure that they had opportunities to ask questions, to interact, to feel comfortable. Do a pre-screening exactly over the phone, make sure that they haven't been sick, don't have a fever, haven't been in contact with someone who's sick. We handle everything over the phone. The medical history is done over the computer. The consent forms, payment are all done over the phone. Patients come into the parking lot. One of my staff wearing a mask and gloves goes out, greets the car. They don't come in. They check their temperature, and then they bring the patient into the office. And the patient is going to wear a mask. And they're literally told either put their hand in their pocket or pretend their hands are in their pocket. And they don't touch anything until they get into that treatment room. Nothing. And then they wash their hands and they do a pre-procedural mouth rinse immediately upon entering the room. So that patient will have entered that office, and other than their feet touching the floor, will have touched nothing in that office until they get to the treatment room that we're working in.
Do you feel that this is going to really limit the number of patients that we can see in a day? Is it going to change the volume and the flow of the practice considerably?
You know, from the standpoint of the treatment rooms and turning over the treatment rooms and cleaning the rooms and generating aerosol, that's a question I can't answer. But I can tell you the interesting thing is that everything we used to do in our consultation rooms or in the reception room, we do over the phone today. So the patient, we review the medical history, review the consent. The patient pays over the phone or they mail us in a check. The patient walks into the room. So we're not actually doing more than we used to do. We're doing the same we used to do. I asked my staff because I need to know if I need to hire more people or have fewer people. You know, after 2 weeks of being open, has this really impacted our efficiency, and are we going to be able to get back to 100%? And the answer I got was very interesting. The answer I got was they feel that what we're doing now is more efficient than what we used to do. There are fewer distractions. Things are handled over the phone on our schedule. You know, when we have people available to make phone calls and get that information over the phone. So it was actually, I was pretty excited about that response. Now, I'm not going to say we can do 110% of what we used to do, of course, but my staff, my front office staff feels that the protocols we have in place and talking over the phone and planning ahead is actually more efficient than it used to be. And so that made me feel pretty good. Prior to this, my hygienist wore a fluid impervious gown, a mask, and a face shield because every patient she uses cleans with ultrasonic and generates an aerosol. I don't think the protocol is going to change. I think we were already adherent to the protocol. I think the data need to be looked at. If you look at aerosol, I mean, there's a lot of data on aerosol generation going 50 years back. Pre-procedural mouth rinses, antimicrobial mouth rinses. This virus is not a real tough bug. It's not going to take a lot to kill this fella. And so I think judicious use and following the college's protocols, I'm concerned as anyone else is, and I don't want to put anyone else at risk. But I think protocols already exist that should be able to manage the aerosol issue. We are going slower now. I mean, I've phased in the start obviously. I mean, we're still just 2 weeks in.
Yeah.
But it's nice. It's remarkable how efficient we are at the front desk now. There aren't a lot of distractions. Patients come in, they're already well prepared. And patients truly do appreciate that they know protocols are in place. The only thing I would say is don't call them and say, well, you know, because of this coronavirus thing, we finally decided to take infection control seriously. You've always been doing infection control seriously. This has simply modified some of your protocols, but you've always been doing infection control and taking it very seriously in your office. And I think that's the important note, is this is nothing new to us as dentists. We've always been managing potential infectious agents for as long as all of us have been in practice.
I'd like to thank Ansgar, Ken, and Lorenza for taking the time to meet with us and share with us their experiences and their positive outlook, as all of us are waiting for guidance here in Ontario to be able to return to care. Manor, what were your thoughts?
Yes, thank you, John. It was a pleasure hearing our colleagues from around the world and their experiences now that they're back into practice. And with that sort of cautious optimism, there is some light at the end of the tunnel. And it was also interesting to hear how no matter where you are around the world, like Lorenza in Italy was saying, with all due respect to industry, she was saying, watch out for jackals and things that are being thrown at us and products and materials that maybe we don't need. So it was interesting and sort of reassuring that everyone's on the same page no matter which corner of the globe we're on, but very informative.
And John and Manor, I think, you know, I was feeling pretty lousy last week, listening to all that might fall on us and focusing on the heavy regulations that might come. But, you know, I realized after hearing our colleagues and what they've gone through, and some of them worse situations than ours, that whatever the guidelines are, we're going to adapt to them. Whatever the restrictions are, we're going to find a way around them. Patients are going to trust us again. We're going to somehow get our staff to trust us, and we're going to come out of this just like we always do, as better than we were before, and being back at our profession. I feel so much more optimistic, even though some of these stories weren't easy. Lorenza certainly is, you know, finding the you know, cumbersome to work under these circumstances, but there's optimism. She's going to adapt to it. I really am starting to feel much more optimistic. I want to thank you both for indulging us or this idea of having our colleagues from around the world.
I couldn't agree with you more, Steve. And Manor, I think as dentists, we've distinguished ourselves in our careers, in our practices, with acts of ingenious intraoral salvage when it comes to taking care of our patients. And this is just another challenge in our careers. We're going to adopt those same skills we've learned as clinicians to adapt, to follow the guidelines. The recommendations from our colleagues would definitely encourage us to take the time to plan for this new normal, coming up with safe protocols for our team and relying on the resourcefulness of our team, and to really take a common sense approach. I think those were themes that would apply to any of us as we're at this time of looking ahead and looking forward to returning to practice. Always embedded in all of these thoughts are a sense of being safe, protecting our patients, our staff's well-being, and obviously our own and our families. So that's today's topic. I'd just like to remind all of you, though, please to continue to sign up for our focus group conversations, opportunity for us to meet with you in a more intimate virtual manner, to share discussions, concerns that you may have. You can do so by following the link available in the YouTube description for our Tuesdays at 2, as well as on our homepage. That looks like this. These focus groups, we've now done these for the last almost 4 weeks, have been very informative for us and hopefully for those colleagues who've taken the time to be with us. I also want to introduce something new from the Dental Community Resource. That's a virtual art class with our dear friend and colleague, Dr. Jack Zosky, which will be starting on Thursday. The link will be available on our website. It's a great way to learn from somebody who's been at this for most of his clinical career too. Finally, please don't hesitate to refer to our website for any information as it becomes available, because these are posted on a daily basis. Please sign up and subscribe to our YouTube channel. I would appreciate you following us that way, and kindly send any emails to community@dentalcommunity.ca. On behalf of Steve, Manor, and the rest of our Dental Community Resource faculty, I look forward to seeing you again Tuesdays at 2 on Tuesday, May the 19th. Be well and stay safe. Thank you.
Thank you, everyone. Be well.